Welcome. Thank you so much for being here and joining the Wellness Academy today. My name's Heather Martin, and I'm a manager for pharmacy primary care services at ucdavishealth. My hope is that by the end of our time together today, you'll leave with a little more information, a little more motivation, and a few more skills to help you make a plan to support your own health and wellness. And also, I hope to inspire you to consider making some wellness choices that may allow you to decrease or even stop the need for some of your medications. Now, you may be wondering, who am I and why do I care about this topic? Well, I've been a clinical pharmacist who's been helping people for over 20 years manage their chronic health conditions like diabetes, high blood pressure, high cholesterol, heart disease, osteoporosis, asthma, or even depression. Essentially, your doctor may ask you to work with a clinical pharmacist because your medical condition is at a stage that they're recommending you take medications as part of your treatment plan. And medication management is what pharmacists are known for. So, if your doctor referred you to me, as your clinical pharmacist, we would check in regularly, make sure your medications were working for you, that they were safe, you weren't having any intolerable side effects, and most importantly, that your medications were effective. Now, early on in my experience working with people with chronic medical conditions, I started to notice some patterns emerge from the stories that people would share about their health and their lifestyles. First, having a medical condition could be hard to cope with on many levels. Emotionally, some people felt embarrassed or ashamed of their condition. Others felt stressed or worried about what they could do to not let their health get any worse. Financially, the cost of medical care, including their new medications, was sometimes a burden. And physically, sometimes their condition itself came with new limitations, discomfort, or even pain. Second, I started to realize that many, if not most of the people I was working with, were coping with chronic medical conditions that in many ways could have been prevented and most definitely could be improved by adopting certain wellness practices into their lifestyles. Lastly, most people were not happy about needing to take prescription medications. I can't remember one person ever telling me how excited they were to take a medication every day. But I do remember many people asking me questions like, how long am I going to have to take this medication? Or when can I stop taking it? And often they didn't really like my answers. But I could offer some hope and help when they asked this question instead. How can I reduce or stop taking my medications? And so I decided that I wanted to be a pharmacist who helped people stop taking medications when they could do it safely. And I know what you may be thinking, so before anyone watching gets worried about me losing my job because people don't need medications or pharmacists anymore, rest assured that is not going to happen, and I'll be fine. Because medications can be an important, powerful tool to treat or cure diseases. And while wellness practices are a really important part of a healthy life, they won't always be a substitute for medication. So, please do not stop taking any of your medications without consulting your healthcare provider first. And this is the part of the lecture where the video editor puts a huge disclaimer up on the screen. And I'm going to repeat, please don't stop taking any of your medications without consulting your healthcare providers first. Thank you. Now that that's settled, let's change gears and talk about some of the things you could do for more wellness and possibly less medication in your life. The first thing you need to get started is to have the right information to help you make the right decisions and set goals for your health. So, take some time to learn about your health condition. Understand what options may exist as an alternative or a complement to medications. There's a lot of information available to help you. At times, so much information, it could be overwhelming. But please remember, you don't have to figure it out on your own. You can always ask your health provider or your pharmacist for advice or guidance. Let's consider an example of how adopting certain wellness practices can lead to needing less medications. In this case, what options exist to lower blood pressure if you have high blood pressure or hypertension? Having high blood pressure can increase your risk for other serious conditions like a heart attack, stroke, or kidney disease. So lowering your blood pressure to safe levels is a key goal to preserve health. Some options for lowering blood pressure include losing weight or maintaining a healthy weight, following a healthy diet or eating plan, quitting smoking or tobacco products, staying physically active, limiting your alcohol, and also taking medications. Let's look more closely at how a healthy diet, specifically the combination of a DASH diet and reducing sodium in your diet, may reduce the need for medication when you have high blood pressure. In 2001, a landmark research trial published in the New England Journal of Medicine reviewed the effects on blood pressure of a reduced dietary sodium and the dietary approach to stop hypertension, or otherwise known as DASH diet. About 400 participants with or without high blood pressure were randomly assigned to two groups, each following a different diet. The two diets were a control diet, typical of what many people in the United States eat, and the DASH diet. The DASH diet emphasized eating more fruits, vegetables, whole grains, and low-fat dairy foods. It includes lean proteins like poultry, fish, or beans, and things like nuts or vegetable oils in moderation. It also limits eating red or fatty meat, full-fat dairy, sweets, and sugar-containing beverages. The DASH diet also contains smaller amounts of total fat, saturated fat, and cholesterol, and larger amounts of vitamins, minerals, fiber, and protein than the typical diet. It also limited the sodium intake. During the study, participants in both diet groups also varied their sodium intake levels in order to assess the impact of sodium intake on blood pressure. For 30 consecutive days, each diet group would also include a high, intermediate, or low level of sodium intake. And each individual participant would change the sodium intake level in a random order, meaning not everyone started at a high sodium level and ended at the low sodium level. This random order change allowed for the impact of sodium level to be assessed independently from diet, and it gave the researchers the options to look at 6 different diet plus sodium level combinations. So, what did the researchers learn? The study found 3 key things that are important for the prevention and treatment of high blood pressure. First, whether you are in the DASH diet or the typical diet group, blood pressure improved simply by lowering your sodium intake alone. However, the DASH diet group lowered blood pressure more than the typical diet at all levels of sodium intake. And participants who followed the DASH diet with the lowest sodium intake had lower blood pressure than either diet change alone. And you may be wondering, how significant was this change in blood pressure? Well, for people who had high blood pressure, the blood pressure lowering effects of the DASH diet plus the lower sodium intake, which was limited to less than 1,500 milligrams per day, was equal to or even greater than the effects of taking a single drug medication therapy for blood pressure management. Meaning, this research shows that lifestyle modifications can allow you to avoid, reduce, or in some cases stop taking medications for your blood pressure. Other lifestyle modifications also have this positive effect on lowering blood pressure. And in this chart, you can see the average of blood pressure lowering from each of these healthy habits by decreasing the systolic blood pressure. Losing weight as much as 5 points, the DASH diet as much as 11 points, combining that with reducing sodium another 5 to 6 points. Quitting smoking can lower blood pressure by 10 to 20 points. Being more physically active as much as 8, and limiting alcohol by 4 points. Any one of these items by itself could have a big impact for your blood pressure, but you may be able to combine more than one new healthy habit and see some additive effects. If you'd like to learn more details about these options and more for controlling blood pressure or protecting your heart health, visit the American Heart Association at www.heart.org. They have a lot of good resources to help you. So how about another example, in this case for persons with diabetes? Diabetes is a chronic metabolic disease that occurs when the body doesn't produce enough insulin or can't use it properly. Insulin is an important hormone that regulates blood glucose levels, and when it's not working properly, too much blood glucose or blood sugar builds up in the bloodstream. And over time, this can lead to serious health problems, including heart disease, vision loss or blindness, kidney disease, nerve damage, foot and skin sores and other infections, and a weakened immune system. This also means that people with diabetes may be recommended to take multiple medications for more than one medical condition in order to protect their health. It's important we understand that there are two main types of diabetes, and the reason why is because in type 1 diabetes, the body doesn't make any insulin, and in this case, medication, specifically prescription insulins, are the best and only treatment option. So, while wellness habits can still be beneficial for other reasons for overall health, medication is essential and saves lives for people with type 1 diabetes. However, in type 2 diabetes, the body makes some insulin, but it doesn't use the insulin properly. So medication is not the only treatment option. In fact, type 2 diabetes can be managed with several lifestyle changes to promote wellness, sometimes alone or sometimes in combination with various medications, including in some cases the use of insulin. A research study published in 2013 in the New England Journal of Medicine aimed to understand the effects of lifestyle intervention in persons with type 2 diabetes. Approximately 5,000 overweight or obese persons with type 2 diabetes were included in the research. Participants completed 1 year of a diet and exercise intervention program and had lost 10 to 15 pounds of body weight doing so. This led to a 10 to 25% less medication use, and it was not limited to just the use of medications for diabetes alone. Blood pressure, cholesterol, and insulin medication use types all decreased. Again, demonstrating that reduced medication use is possible by incorporating healthy habits into your lifestyle. There's overwhelming scientific evidence that healthy lifestyle and wellness habits have a significant impact at preventing and treating disease, and in many cases, reducing the need for medication. Without boring you with too many details, let's at least take a minute to summarize some of the positive benefits that may inspire you to give one of these wellness habits a try. Maintaining a healthy body weight has not only been shown to improve diabetes, but it can also prevent the development of diabetes as well. For people living with arthritis, a healthy body weight can be beneficial to reduce or manage joint pain, and additionally, maintaining a healthy body weight is associated with lower rates of cancer, all of which can lead to less medication use for any of these conditions. As we already learned, eating a healthy diet can lower blood pressure and help manage type 2 diabetes. It has also been shown to be an effective way to lower your risk for both heart disease and cancer, again, leading to less medication use. Quitting smoking, vaping, or use of tobacco products is likely the most significant healthy lifestyle habit you can adopt to protect your health. If you recall earlier in this presentation, quitting smoking had the largest impact on lowering systolic blood pressure by as much as 20 points. In many studies, quitting smoking cut the risk of heart attack or death by 50% or more. It also reduces the symptoms, complications, and disease progression for persons with lung conditions like asthma or COPD. Tobacco use is associated with 30% of all cancer-related deaths. It increases the risk of not only lung, mouth, and esophageal cancers, but also pancreatic, bladder, cervical, and kidney cancers as well. In so many ways, quitting tobacco will help you to need less medications. And if you don't use tobacco, then the best way to need less medications will be never to start. If you need support quitting, talk with your healthcare provider or learn more at www.cdc.gov/tobacco. Or if you're in California like us and UC Davis Health, visit www.kickitca.org for more help. Now, just like eating a healthy diet, staying physically active can also improve blood pressure and improve diabetes, lower your risk for heart disease and cancer. Also, staying active is associated with maintaining bone and joint health and reducing the risk for development of osteoporosis and some forms of arthritis, all of which again lead to less medications. Additionally, research has shown that overweight people who are active live longer than people who don't, even if they do not lose or achieve a healthy weight level. and people who are active report better sleep, a feeling of more energy, and less feelings of depression or anxiety. So there's a lot of positive reasons to consider being more active. Aim for 150 minutes of moderate intensity or 75 minutes of high intensity exercise each week. This can be as simple as enjoying a 30-minute brisk walk 5 times a week. Lastly, limiting alcohol use can improve blood pressure, diabetes, prevent heart disease, prevent liver disease, and lower your risk for cancer, all of which increase your chances of needing less medications. If you're noticing a theme, there is one. There's no safe level of alcohol use. However, alcohol use with the lower risk for health problems listed would include 2 or fewer drinks on any one day and less than 14 per week, ideally with some alcohol-free days every week. If you need support reducing your alcohol use, talk with your healthcare provider. You can also learn more at www.samhsa.gov, or you can call a 24-hour-a-day confidential hotline at 1-800-662-HELP. So, no matter what you choose, adopting one or more of these wellness habits will help you to avoid or reduce your need for medications to maintain health. And you may decide that the combination of healthy habits and taking medication is what's right for you. The good news is you have many options to consider. So after you've got the information you need about your health conditions and your options, step 2 will be to assess your motivation to make some changes. So, I recommend you make a list of your options and ask yourself, what things am I most motivated or willing to try? Maybe you prefer not to or want to limit the need for medications at this time. And you don't drink alcohol, so that really isn't an option for you either. And while you know losing a few pounds or quitting smoking would be really good for your health, it feels daunting to tackle these big changes right now. You'd like some more time to consider the options before working on these habits. For the most success making healthy habit changes, focus on one thing at a time and start with small, achievable goals. When you succeed at a goal, you feel great, and this is a natural reward, so your motivation goes up and you may be more likely to try another healthy habit. As you get ready to make a change, ask yourself, on a scale of 1 to 10, with 1 being not ready at all and 10 being extremely ready, how ready am I to make this change? If you mark yourself somewhere between a 1 and a 4, you're probably not very ready to change. What can you do? Wait until you feel more ready. Get more information to help you feel ready, or seek some motivation. Talk with others who've had some success with this change and learn about their success stories to inspire you. Revisit this healthy habit on a future date and rate your readiness again. If you find yourself rating your readiness between a 5 and a 7, you're a little bit ready, but maybe need a little more motivation. Ask some questions to learn about what is motivating you. Why didn't I select a 3? Why didn't I select an 8? What would need to be different in my life right now for me to choose a 9 or a 10? Asking those questions and reflecting on them, you'll learn a lot about yourself and possibly help you move towards being a 9 or a 10, where you'll feel more ready to make some changes. Revisit this healthy habit on a future date and rate your readiness again. Now, if you mark yourself an 8 or higher, you are mostly to extremely ready to make this change. You have a high chance of being successful, and this is probably a habit to focus on. Let's rate both using the readiness scale on a scale of 1 to 10. Using the question, how ready am I to change my diet or eating habits, you rank yourself an 8. Being mostly or extremely ready. Using the question, how ready am I to change my physical activity level, you actually find you're more like a 6. So you're somewhat ready, but not quite as ready to tackle that one at this time. So let's focus on using the healthy eating habits as a place we'll work on going forward. And now that you're equipped with the information you need to make the decision, and the understanding of your motivation and readiness to make a healthy habit change, it's time to make a plan. Specifically, I want you to make something called a SMART plan. That will help you to be successful, and we'll walk through the steps of that in a moment. Step 1 of the SMART plan will be to write your SMART goal. SMART standing for specific, measurable, action-oriented, realistic, and time-bound. These are the elements of a goal that will help you to be successful. We'll walk through the hypothetical steps of making a SMART plan, and we'll use the habit choice of changing your eating habits to improve your blood pressure. If you'd like to follow along, you can use the worksheet that was provided by the Wellness Academy or use a piece of paper. Either will work. As you can see, the first step in the SMART plan is to write the SMART goal to be specific, measurable, action-oriented, realistic, and time-bound. So, if I wanted to improve my eating habits to lower blood pressure, as you recall, we could work on a DASH diet plan, we could lower sodium. Let's pick sodium. I'm feeling a little more motivated for that change, and I think I have some opportunities to improve. So, I want to reduce my sodium intake of my food. And you'll notice at the top in this worksheet example, it's asking you to pick a start date and a period of time. That's the time-bound component of your goal. So, for the next 2 weeks, I will reduce sodium intake of my food. However, I think we can be more specific and include a little bit more of how much, with whom, when, how often, where. It'll help us be successful if we can commit to some specifics and say, for the next 2 weeks, I will reduce the sodium intake of my food by not adding salt to dinner meals at least 4 times a week or more. That gives us the extra specifics of how much, when, how often, and it holds me accountable to what I'm trying to achieve. Now you might be wondering, but if I need to reduce my sodium, why not just do it every day? Why only 4 times a week? Well, if you remember, we want to create a success experience because if you're successful at reaching your goal, you'll feel great, you'll feel proud and motivated. Your motivation will go up and it will give you more confidence to continue to try other healthy habits that you may feel more intimidated by or less confident. So, step 2 of your SMART plan is the M for monitor your progress. And you'll want to answer this question, I will monitor my progress by, and write it down. Be specific about how you're going to do it. In this case, I'll say, I'm going to monitor my progress by putting this paper and a pencil near my table and making a check mark for each day I do not add extra salt. I don't have to get any more supplies. I can use my piece of paper that I wrote my plan on, and I'll put it in a convenient spot where I'm going to eat so I can remember to keep track. This is just one option. You can do whatever is best for you. If you're someone who likes using your electronic calendar on your phone, you can use that. I've had people share stories where they found it really motivating to put a old-fashioned gold star sticker on their calendar. You could do that. Whatever works for you. But in this case, I'll just make a check mark on this paper. The third step is the A in the SMART plan, which means to arrange for success. In order to be successful at achieving my goals, I want to set up an environment that will help me to be successful. So think about, how am I going to get ready? What will make it easier for me to succeed at this goal? And answer the question, I will prepare to be successful by. In this case, I'm thinking, I will remove the salt from my table and put it away inside a kitchen cabinet. I've put it somewhere more inconvenient, and it'll also be a visual reminder that I have this goal of not salting my food as often. Now, we could do some other things like substituting a different herb or spice, many other options. But in this case, this felt like a logical thing that might help me with this goal. The fourth step is the R in your SMART plan, which means recruit support. You never have to do this alone. By telling other people, trusted friends or family, what you're doing, it helps you to stay accountable, and it also means you can recruit some people to be a cheerleader to support you. So answer the question, I will get support by, and write down that plan. I'm thinking in this case, I'm going to ask for support by asking my family to help me by also putting the salt away if they use it. They may not be wanting to change their diet in the same ways that I do, or they have different health conditions. So as long as I tell them up front, hey, I'm trying to use less salt, and so I'm going to put the salt away in a cabinet to store it out of sight. If you use it, will you please help me by putting it away in the cabinet? And that way, they know what you're doing and they can support you to be successful. The fifth step of your SMART plan is to come up with a way that you might treat yourself as a reward for accomplishing your goal. How can you celebrate this in a healthy way? I want to make a recommendation that you avoid using food rewards, because if you reward yourself with ice cream for not using salt, you may end up with a different bad habit that you want to break later, or a different habit that contributes to your health in a negative way. So, with that in mind, think of something that's meaningful to you. A lot of people I've worked with sometimes struggle with this aspect of their plan. They feel very internally motivated and aren't sure that they actually need something to reward themselves. But please try to think of something and write it down. It does actually help knowing, with all the hard work you've put in on this for the last 2 weeks, there's some way that you can celebrate your success. So, in this case, I'm going to say that I'm going to ask my family for a high five or a hug every day I achieve my goal. This might seem silly to you, but to me, this would be really meaningful. And so I wrote it down. I've heard people share stories of other ways that they help to reward themselves. One example, a person who was working to increase physical activity wanted to go to the gym more often. So they decided to prepare their gym bag and keep it by the front door so they could take it with them to work and go to the gym after work. They also really enjoyed using a special perfume that was a little bit more expensive. So they decided their reward would be that they'd keep the perfume in the gym bag and only allow themselves to use it on days that they went to the gym. Other people who've been maybe working on a weight loss or healthy weight goal may set a long-term reward of going out shopping for a new outfit when they've achieved a certain weight. That's great too, whatever works for you. But it is nice if there's a daily way to have a reward, so that way you get some immediate feedback that you've achieved the goal that day. After you've written your SMART plan, stop and use the 1 to 10 scale one more time, but ask yourself, how confident am I that I can achieve my SMART goal? Just like you did before, assess your confidence and figure out why. So remember, we want you to have a success experience in making the new habit, because reaching that goal is going to feel great. You're going to be really proud and increase your motivation at making more healthy habits. If you're not in the green zone between 8 to 10, that's okay. We don't need to give up. You may just want to go back and tweak your SMART goal to make it a little more achievable for you. So, for example, maybe the sodium use, I would say, I'm not going to salt my food 2 days a week instead of 4, and reassess my confidence. Over time, each of these small steps will start to develop little habits that build upon each success, and eventually you can achieve big changes. After 2 weeks, review your SMART plan to see how it went. Did you reach your goal? If not, don't give up. Instead, ask yourself, what did I learn during this time? How can I modify my goal for the next 2 weeks to try again? Forming new habits takes doing something consistently for several weeks in a row, because practice makes perfect. Modify your SMART plan and start again. The more you try, the more you'll learn, and the more likely you are to succeed with time and practice. If you did reach your goal, congratulations. Also though, ask yourself, what did I learn? How could I modify my goal for the next 2 weeks? What healthy habits should I work on now? Should I make any changes or continue? It's not uncommon for people to want to continue the same goal for another few weeks, or just make it slightly more challenging. That's normal, because remember, practice makes perfect. Modify that plan and just keep going. Build on your initial success and repeat the process until you've adopted all the healthy habits you want. Ready to give this a try? You can use the SMART Plan worksheet that was available in the Wellness Academy. You could also learn more about this technique in the book Living Smart, which is by Joshua Klapow and Sherry Pruitt. Also, if in general you'd like to learn more about habits and how habits can impact your health and life, consider reading these books, The Power of Habit by Charles Duhigg or Atomic Habits by James Clear. Both are fun reads that can give you more information about how habits may be impacting your health. Because really, most of what we do each day is a habit of some kind. Brushing our teeth, having a cup of tea with breakfast, the route we take to go to work, or how and when we put on our pajamas and go to bed each night. They're all habits practiced and perfected over time. This includes when you're needing to take a medication every day or developing healthy wellness habits every day to help you minimize or stop taking medications. Both are habits, so if your goal is to reduce your need for medication, you now have some information to help you decide what your options are, the readiness scale from 1 to 10 to help you assess your motivation and decide which option to choose, and you're able to create your own SMART plan to help you be successful in making that healthy habit change. I'm confident that when you're ready to get started, you'll be successful at reaching your health goals. Thank you so much for your attention and participating today, and I hope you enjoyed the rest of UC Davis Wellness Academy.